Gang, I'm here to talk to you about what successful treatment looks like for the lower back and sciatica. So you've watched the videos on identifying the three most common causes, which is SI pain, stenosis, and disc herniations. Once you find out the type, then it's important to realize that the type of lower back pain does not give you enough information. Now you know what to do about it. And so when we talk about this, we know that for a common treatment is surgery. So they'll do a fusion for stenosis or for SI pain or for disc herniations. And we know that any surgery for the lumbar spine, that only 50% of the time they are successful. So that to me is not successful surgery or a successful treatment. That's sometimes successful. We look at physical therapy and we know that studies show that 85% of the time that a 2-year success rate is 85%. So that's a very successful rate. Now, that doesn't mean that all physical therapy is created equally. Much of the traditional physical therapy out there focuses on simply the spine itself. So they'll heat it up, cool it down, ultrasound, e-stim, stretching it, exercising it. But the reality is that right there is not what I would define as successful treatment. Successful treatment of the lower back needs to involve looking around the lower back, so the areas above and below. So when we look at this picture right here, this is a demonstration that my left foot in the red guy here, the red skeleton, can be, sometimes I'll have one foot that's a little bit more pronated than the other. That's a common, just one option here to show. But that foot being more pronated can affect the knee, which can drop the hip down, which can ultimately compress one side of the lower back, the SI joint. It can cause pain up the chain. So successful treatment, number one, needs to look at the feet. How are the feet moving? The foot motion is going to dictate what the hips are doing. The second most common area is the hips. We need to look at the hips. How are the hips moving? When we identify that the lower back is only designed, sorry about my slides here. I have a really important slide I want to show. So here's the important slide I want to show you, that the lumbar spine itself is only designed to rotate 5 degrees. That's amazing when you think about it. When I talk about how important the hips are a big ball and socket joint that are designed to rotate more than 60 degrees. So if my hips stop rotating, which a lot of people have, then your body's going to ask the rotation to come from somewhere else. So then we immediately start to see the lumbar spine rotating more than it's supposed to rotate. So many people have pain in the lower back and they say, well, it hurts when I twist. And usually the twisting isn't the lower back's fault. It's the fact that the hips aren't rotating very well. That's one option. We also know that the lower back is only designed to side bend 20 degrees left and right. It's only designed to flex forward 40 degrees, and it's only then designed to extend backwards 30 degrees. So think about that. 40 degrees of forward bending, most of the time you can reach down and get close to the floor. Some people can touch the ground. That's definitely more than 40 degrees. That's more like 90 degrees. So you've got 50 degrees coming from the hips, 40 coming from the lower back. Now, if you're getting to the limit and you're trying to reach farther than your lower back wants you to, your hips are tight and your lower back's going to suffer from that. So this is just an example of how biomechanically the lower back's only designed to do so much. So again, successful treatment includes looking at the feet, looking at the hips. This is a muscle that's really powerful, and you see this image. This is a muscle called the iliopsoas. It attaches to the lumbar spine and it comes all the way down into the hips. This is the most common hip muscle that's limited in people that have low back pain. The reason is because when we sit down, this muscle gets very, very short. And all of us naturally are sitting too much because of the society we live in. So when we go to stand up, this muscle has to lengthen and it yanks on the spine. It can compress the discs, it can make the back arch, it can make us have sciatica. So this is the number one reason why someone walks into our clinic on a daily basis. Now, the third most common area that we look at for somebody that has low back pain is what's happening above the spine. How's that mid-upper back doing? And a lot of people have tightness up there as well. As you move up the spine is designed for more and more movement. So we try to steal motion from above to reduce the motion that's happening in this damaged lower back. So hopefully that gives you some insight on the top 3 areas and what successful treatment looks like for lower back pain.